फ्रेंड्स, आज हम लोग पढ़ने जा रहे हैं चैप्टर 4 रिप्रोडक्टिव हेल्थ। इसकी नॉर्मल रीडिंग करेंगे। इंडिया वॉज द अमंग्स फर्स्ट कंट्रीज इन द वर्ल्ड टू इनिशिएट एक्शन प्लान्स एंड प्रोग्राम्स एट अ national level to attain total reproductive health as a social goal. These programs, called family planning, were initiated in 1951 and were periodically assessed over the past decades. यहाँ पर बहुत इम्पॉर्टेंट है ये लाइन कि दीज प्रोग्राम्स यानी कि फैमिली प्लानिंग वर इनिशिएटेड इन 1951। ये डेट हमेशा याद रखिएगा, बहुत इंपॉर्टेंट क्वेश्चन आता है नीट में। सो इम्प्रूव प्रोग्राम्स कवरिंग वाइडर reproduction related areas are currently in operation under the popular name Reproductive and Child Health Care (RCH) programs, creating awareness among the people about various reproduction related aspects and providing facilities and support for building up a reproductively healthy society. A major task under these programs, with the help of audio visual and the print media, governmental and non-governmental agencies have taken various steps to create awareness among the people about reproduction related aspects. Parents, other close relatives, teachers and friends also have a major role in the dissemination of the above information. यानी dissemination का मतलब होता है spread widely, to spread widely among the people. ठीक है, so dissemination of the among information. Introduction of sex education in schools should also be encouraged to provide right information to the young so as to discourage children from believing in myths and having misconceptions about sex related aspects. Proper information about reproductive organs, adolescence and related changes, safe and hygienic sexual practices, sexually transmitted diseases, that is STD, AIDS, etc., would help people, especially those in the adolescent age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in marriageable age group, about available birth control options, care of pregnant mothers, postnatal care of the mother and child, importance of breastfeeding, equal opportunities for the male and female child, etc., would address the importance of bringing up the socially conscious, healthy families of desired size. Awareness of problems due to uncontrolled population growth, social evils like sex abuse and sex related crimes, etc., need to be created to enable people to think and take up necessary steps to prevent them and thereby build up a socially responsible and healthy society. Successful implementation of the various action plans to attain reproductive health requires strong infrastructural facilities, professional expertise and material support. These are essential to provide medical assistance and care to the people in reproduction related programs like pregnancy, delivery, STDs, abortion, contraception, menstrual problems, infertility, etc. Implantation of better techniques and new strategies from time to time are also required to provide more efficient care and assistance to people. Statutory ban on amniocentesis, this is very important topic for NEET. Okay, statutory ban on amniocentesis for sex determination to legally check increasing menace of female feticides, massive child immunization, etc., are some programs that merit mention in this connection. In amniocentesis, ये बहुत important word है, ठीक है। Some of the amniotic fluid of the developing fetus is taken to analyze the fetal cells and dissolve substances. This procedure is used to test for the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, determine the survivability of the fetus. बहुत इम्पॉर्टेंट है amniocentesis नीट के पर्सपेक्टिव से भी. Research on the various reproduction related areas are encouraged and supported by the governmental and non-governmental agencies to find out new methods or to improve the existing ones. Do you know that Saheli, a new oral contraceptive for females, was developed by scientists at Central Drug Research Institute (CDRI) in Lucknow, India. ये बहुत इंपॉर्टेंट क्वेश्चन ये भी है कि सहेली जो था वो डेवलप हुआ था CDRI इन लखनऊ, ठीक है, ये बहुत ज़रूरी है नीट के पर्सपेक्टिव से भी. बेटर अवेयरनेस अबाउट सेक्स रिलेटेड मैटर्स, इंक्रीज नंबर ऑफ मेडिकली असिस्टेड डिलीवरीज एंड बेटर पोस्ट नाटल केयर लीडिंग टू डिक्रीज्ड maternal and infant mortality rates, increased number of couples with small families, better detection and cure of the STDs, and overall increased medical facilities for all sex related problems, etc., all indicate improved reproductive health of the society. Now, population stabilization and birth control. In the last century, an all-round development in the various fields significantly improved the quality of the life of the people. However, increased health facilities among with better living conditions have an explosive impact on the growing population. The world population, which was around 2 billion, that is 2000 million in 900, rocketed to about 6 billion by 2000 and 7.2 billion in 2011. ये क्वेश्चन आते हैं कि 1900 में 2 बिलियन यानी कि 2000 मिलियन, ये 2000 तक पहुँचते पहुँचते 6 बिलियन हो गए एंड 2011 तक ये 7.2 बिलियन हो गए. ये डाटा याद करना नीट के पर्सपेक्टिव से बहुत इंपॉर्टेंट है. अ सिमिलर ट्रेंड वॉज ऑब्जर्व्ड इन इंडिया टू. आर पॉपुलेशन विच वॉज अप्रॉक्सीमेटली 350 मिलियन, ये इंडिया की बात हो रही है, ओके, 350 मिलियन एट द टाइम ऑफ आर इंडिपेंडेंस रीच्ड क्लोज टू द बिलियन मार्क बाई 2000 एंड क्रॉस्ड 1.2 बिलियन इन May 2011. ये बात इंडिया की हो रही है, ठीक है. अ रैपिड डिक्लाइन इन डेथ रेट, मैटरनल मोर्टेलिटी रेट दैट इज MMR, and infant mortality rate that is IMR, as well as increased number of people in reproducible age are probable reason for the for this. Though through our reproductive child health, that is RCH program, though we could bring down the population growth rate, it was only marginal. According to 2011 census report, the population rate was less than 2%, that is 20 by 1000 per year. Okay, सो ये ज़रूर याद कर लेना. ये सब डाटा बहुत इंपॉर्टेंट होते हैं, तुरंत ऐसे ऐसे लाइन ही दे देता है, सीधा सीधा नीट में क्वेश्चन पूछ लेता है. द पॉपुलेशन ग्रोथ रेट was less than 2%, a rate at which our population could increase rapidly. Such an alarming growth rate could lead to an absolute scarcity of even the basic requirements, food, shelter and clothing, in spite of significant progress made in those areas. Therefore, the government was forced to take up serious measures to check the population growth rate. The most important step to overcome this population is to motivate smaller families by using contraceptive methods. You might have seen advertisements in the media as well as poster bills showing a happy couple with 2 children with a slogan of "Hum do, hamare do, we too are too." Many couples, mostly the young urban working ones, have even adopted an one child norm, statutory rising of marriageable age of the female to 18 years and that of male is 21 year. ये भी पूछ लिया जाता है, भले ही आसान है बट कभी कभी जो आसान क्वेश्चन होते हैं वो भी टफ लगते हैं. ओके, एंड incentives to given to couples with small families are two of the other measures taken to this problem. Let us describe some of the commonly used contraceptive methods which help to prevent unwanted pregnancies. An ideal contraceptive should be user-friendly, easily available, effective and reversible with no or least side effect. ये line ज़रूर याद कर लेना. It also should in no way interfere with sexual drive, desire or the sexual act of the user. ये लाइन बहुत ही इंपॉर्टेंट है. A wide range of contraceptive methods are presently available which could be broadly grouped in the following categories, namely natural or traditional, barrier, IUDs, that is oral contraceptives, injectables, implants and surgical methods. ये सब याद रखना नीट के पर्सपेक्टिव से बहुत ही ज़्यादा इम्पॉर्टेंट है. Natural methods work on the principle of avoiding chances of the ovum and sperm meeting. ये भी लाइन याद रख लेना. Periodic abstinence is one such method in which the couples avoid or abstain from cetus from day 10 to 17 of the menstrual cycle when ovulation could be expected. As chances of fertilization are very high during this period, it is called fertile period. Therefore, by abstaining the cetus during this period, conception could be prevented. Withdrawal or cetus interruptus is another method in which the male partner withdraws his penis from the vagina just before ejaculation so as to avoid insemination. ये एक एक लाइन याद कर लेना. Lactational amenorrhea, absence of menstruation method is based on the fact that ovulation and therefore the cycle do not occur during the period of intense lactation following parturition. Therefore, as long as the mother is breastfeeds the child fully, chances of conception are almost nil. The chances of conception are almost nil. However, this method has been reported to be effective only up to a maximum period of 6 months following parturition. 6 months following parturition. As no medicines or devices are used in these methods, side effects are almost nil. Chances of failure though of this method are also high. ये एक एक लाइन बहुत इंपॉर्टेंट है नीट के पर्सपेक्टिव से. In barrier methods, ovum and sperms are prevented from physically meeting with help of barriers. Such methods are available for both males and females. Condoms, this is condom, okay, where this is condom. So condoms are barriers made of thin rubber latex sheath that are used to cover the penis in the male and vagina and cervix in the female just before the cetus so that the ejaculated semen would not enter the female reproductive tract. This can prevent conception. Nirod is popular brand of condom for male. ये भी question आ चुका है. Use of condoms has increased in recent years due to additional benefit of protecting the user from contrasting STIs and AIDS. ये बहुत important line है. Both the male and female condoms are disposable. ये भी line बहुत important है. Can be self-inserted and thereby gives privacy to the user. Diaphragm, cervical caps and valves are also the barrier made up of rubber that are inserted into the female reproductive tract to cover the cervix during the cetus. They prevent conception by blocking the entry of the sperms through the cervix. They are reusable. These three are reusable. इनको दोबारा यूज़ किया जा सकता है लेकिन कॉन्डम्स को नहीं. So, spermicidal creams, jellies and foams are usually used along with these barriers to increase the contraceptive efficiency. Okay. Another effective and popular method is the use of intrauterine devices. ये बहुत important question आता है IUDs के बारे में. These devices are inserted by doctors or expert nurses in the uterus through vagina. These intrauterine devices are presently available as the non-mediated IUDs. नॉन-मीडिएटेड IUDs इसमें सिर्फ 3 आते हैं, ठीक है. एक लाइपस लूप, एक कॉपर रिलीजिंग IUD दैट इज CUT एंड CU7 मल्टीलोड 375 एंड हार्मोन रिलीजिंग IUDs दैट इज प्रोजेस्टासर्ट LNG20. सो आपको ऐसे याद करना है नॉन-मीडिएटेड IUDs क्या होते हैं. पहला होता है लाइपस लूप और दूसरा कॉपर रिलीजिंग IUDs के एग्जाम्पल ये 3 होते हैं और हार्मोन रिलीजिंग IUDs के एग्जाम्पल ये 2 होते हैं प्रोजेस्टासर्ट एंड LNG20. सो IUDs increase phagocytosis of sperm within the uterus and the copper ions release suppress the sperm motility and the fertilizing capacity of the sperm. ये लाइन याद कर लेना. The hormone releasing IUDs in addition make the uterus unsuitable for implantation for implantation and the cervix hostile to the sperms. IUDs are ideal contraceptive for the female who want to delay pregnancy and or space of children. It is one of the most widely accepted method of the contraception in India. Oral administration of the small doses of either progestogens or progestogen estrogen combinations is another contraceptive method used by females. They are used in the form of tablets and hence popularly called pills. Pills have to taken daily for a period of 21 days, starting preferably within the 5 days of menstrual cycle. After a gap of 7 days during which menstruation occur, it has to be repeated in the same pattern till the female desires to prevent conception. They inhibit ovulation and implantation as well as alter the quality of cervical mucus to prevent retard entry of sperm. ये लाइन भी याद कर लेना, ये जो लाइन है ना, alter the quality of cervical mucus, ये बहुत important है. Pills are very effective with lesser side effect. यहाँ lesser side effect है, मतलब side effect तो होता है लेकिन less होता है, and are well accepted by females. सहेली, the new oral contraceptive for the female, contains non-steroidal preparation. ठीक है, non-steroidal preparation. It is a once a week pill with very few side effects and high contraceptive value. Progestogens alone or in combination with estrogen can be used by females as injections or implants under the skin. Their mode of action is similar to that of the pills and their effective periods are much longer. Administration of the progestogens or progestogen estrogen combination or IUDs within 72 hours of cetus have been found to be very effective as emergency contraceptives, as they could be used to avoid possible pregnancy due to rape or casual unprotected intercourse. Surgical methods are also called sterilization. ठीक है, ये भी बहुत इंपॉर्टेंट टॉपिक है. आर जनरली एडवाइज फॉर द मेल और फीमेल पार्टनर एज टर्मिनल मेथड टू प्रिवेंट एनी मोर प्रेगनेंसीज. Surgical intervention blocks the gamete transport and thereby prevent conception. Sterilization procedure in the male is called vasectomy, क्योंकि यहाँ पर vas difference को कट कर दिया जाता है, and that in female tubectomy, क्योंकि यहाँ पर जो ट्यूब्स होती हैं उनको कट कर दिया जाता है, फलोपियन ट्यूब्स को. ठीक है, तो फीमेल में ट्यूबेक्टोमी एंड मेल में वैसेक्टोमी. इन वैसेक्टोमी a small part of vas deferens is removed or tied up through a small incision on the scrotum, whereas in tubectomy a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are mildly effective but their reversibility is very poor. ये देखिए, इसका फिगर बहुत इंपॉर्टेंट है, इसको ज़रूर देख लेना. ये वास डिफरेंस कट किया गया है किसमें, मेल में. ठीक है, स्टेरिलाइजेशन. और यहाँ पर फेलोपियन ट्यूब को कट किया गया है और टाई कर दिया गया है. नाउ वी विल स्टडी अबाउट MTP, that is medical termination of pregnancy. Intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy, और induced abortion भी बोलते हैं इसको. Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts to 1/5 of the total number of the conceived pregnancy in the year. ये डाटा ज़रूर याद रखना. Whether to accept or legalize MTP or not be is being debated upon in many countries due to emotional, ethical, religious and social issues involved in it. Government of India legalized MTP in 1971. ये इंडिया की बात हो रही है जब MTP यहाँ पर लीगल कब हुआ था, 1971 में, with some strict conditions to avoid its misuse. Such restrictions are all the more important to check indiscriminate and illegal female feticides, which are reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancies either due to casual unprotected intercourse or failure of the contraceptive use during cetus or rapes. MTPs are also essentials in certain cases where continuation of the pregnancy could be harmful or even fatal either to the mother or to the fetus or both. MTPs are considered relatively safe during the first trimester. Okay, during the first trimester up to 12 weeks of pregnancy. ये ज़रूर याद रखना. Second trimester abortions are much more riskier. One disturbing trend observed is that a majority of the MTPs are performed illegally by unqualified quacks, which are not only unsafe but could be fatal too. Another dangerous trend is the misuse of amniocentesis to determine sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by MTP. This is totally against what is legal. Now, such practices should be avoided because these are dangerous both for the young mother and the fetus. Effective counseling on the need to avoid unprotected fetus and the risk factors involved in illegal abortions, as well as providing more health care facilities, could reverse the mentioned unhealthy trend. Now we will talk about sexually transmitted infection. ये भी बहुत important topic है. Infection or diseases which are transmitted through sexual intercourse are collectively called sexually transmitted infection, that is STI, or venereal disease, that is VD, or reproductive tract infections. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent years, HIV leading to AIDS, are some of the common STIs, that is sexually transmitted infections. Among these, HIV infection is the most dangerous and is discussed in the detail in chapter 8. Some of these infections like hepatitis B and HIV can also be transmitted by sharing of injection needles, surgical instruments, etc. with infected person, transfusion of blood, or from an infected mother to the fetus too. Except for the hepatitis B genital warts, hepatitis B genital herpes and HIV infection, other diseases are completely curable. यानी कि ये 3 diseases को curable नहीं है, इनको सही नहीं किया जा सकता है, बाकी सबको curable हैं if detected early and treated properly. Early symptoms of the most of these minor and include itching, fluid discharge, slight pain, swellings, etc. in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence of or less significant symptoms in the early stage of infection and the social stigma attached to STIs deter the infected person from going to timely detection and proper treatment. This could lead to complications later, which include pelvic inflammatory diseases, that is PID, abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. STI are a major threat to a healthy society. Therefore, prevention or early detection and the cure of these diseases are the primary consideration under the reproductive healthcare programs. Through all the persons are vulnerable to these infections, their incidences are reported to be very high among the persons in the age group of 15 to 24 years के लोगों में ज़्यादा हाई होता है ये सब बीमारी होने का chances. The age group to which you belong, of course I belong to this age group, there is no reason to panic because prevention is possible. One could be free from these infections by following simple principles. Avoid sex with unknown partners or multiple partners. Always try to use condom during cetus. In case of doubt, one should go to a qualified doctor for early detection and get complete treatment if diagnosed with infection. Infertility. A discussion on reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India, are infertile. They are incapable unable to produce children in spite of unprotected sexual cohabitation. ठीक है. The reason for this could be many physical, congenital diseases, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized healthcare units, infertility clinics, etc. could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples could be assisted to have children through the certain special techniques commonly known as assisted reproductive techniques, that is ART. अब ये टॉपिक भी बहुत इंपॉर्टेंट है. इन विट्रो फर्टिलाइजेशन IVF, fertilization outside the body in almost similar condition as that in the body, followed by embryo transfer, that is ET, is one of such methods. In this method, popularly known as test tube baby program, ova from the wife or donor female and sperms from the husband, that is donor male, are collected and induced to form zygote under stimulated conditions in the laboratory. The zygote or early embryos with up to 8 blastomeres could then be transferred into the fallopian tube. ZIFT, zygote intrafallopian transfer इसे कहते हैं. ठीक है. And embryos with more than 8 blastomeres into the uterus, मतलब अगर 8 से ज़्यादा ZIFT 8 तक जो है ये कहाँ गया, द zygote और अर्ली एम्ब्रियोज अप टू 8 ब्लास्टोमेयर्स ट्रांसफर्ड इनटू द फलोपियन ट्यूब. तो फलोपियन ट्यूब में 8 ब्लास्टोमेयर्स तक होगा सिर्फ. ठीक है. और 8 ब्लास्टोमेयर्स से ज़्यादा यूट्रस में ट्रांसफ़र होता है, जिसको हम IUT इंट्रा यूट्रिन ट्रांसफ़र कहते हैं. टू कंप्लीट इट्स फर्दर डेवलपमेंट, एम्ब्रियोज फॉर्म्ड बाय इन वीवो फर्टिलाइजेशन, दैट इज़ फ्यूज़न ऑफ गैमीट्स विद इन द फीमेल. ये इन वीवो फर्टिलाइजेशन और बहुत कंफ्यूज करता है विट्रो फर्टिलाइजेशन से. ठीक है. तो इसको ध्यान से देखना. दैट एम्ब्रियोज फॉर्म्ड बाय इन वीवो फर्टिलाइजेशन, फ्यूजन ऑफ गैमीट्स विद इन द फीमेल could be used for such transfer to assess those females who cannot conceive. Transfer of an ovum collected from a donor into the fallopian tube, gift, gamete intrafallopian transfer of another woman or female who cannot produce one but can provide suitable environment for fertilization and further development is another method attempted. Intracytoplasmic sperm injection, ICSI, is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. In fertility cases, either due to inability of the male partner to inseminate the female or due to very low sperm counts in the ejaculates, could be corrected by artificial insemination, that is AI technique. In this technique, the semen collected either from the husband or healthy donor is artificially introduced into the vagina or into the uterus, that is IUI, intrauterine insemination of the female. Though options are many, all these techniques require extremely high precision handling by specialized professional and expensive instrumentation. Therefore, these facilities are presently available only in few centers of the country. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of these procedures is to have children, in India we have so many orphans and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption, and it is as yet one of the best methods for the couples looking for parenthood. Thank you.